Hello viewers, this is the Master Medic, and today I bring to you the explicit explanation of the content of the nursing care plan sheet. Kindly like this video, subscribe and share it to your friends to also benefit from this. What do we mean by nursing care plan? Nursing care plan section in your document is the heart of clinical reasoning and patient-centered care. Based on the surrounding of this page, it is structured as a formal assessment to use during practical evaluation. The purpose of nursing care plan. What is the purpose of nursing care plan? We do nursing care plan to demonstrate your ability to assess a patient holistically, translate clinical findings into actionable nursing diagnosis. Nursing care plan also plan, implement, and evaluate nursing interventions. Nursing care plan also shows your grasp of individualized care, safety, and outcome tracking. Let's come to the care plan sheet. When you are given the care plan sheet at the exams hall, you will be told to write your index number and then your candidate's signature. That is your signature. After that, when the time begins, which is the 30 minutes or the 25 minutes that will be given to you, what you do is that these are called personal data, which you are going to look into the scenario and write it up. Everything or every data that you need is in the scenario. So the patient's name is in the scenario. The ward number 2 is in the scenario. Bed number 2 is there. Inpatient number, which is the same as the folder number. The age of the patient, the sex, religion, diagnosis, occupation, physician or surgeon, the one that took care of the patient or the one that diagnosed the patient. Date of admission, the day that patient reported to the hospital. Then date of discharge, then operation. As for operation here, if the patient, due to the condition, patient was told to go and perform surgery, let's say laparotomy, appendectomy, or anything that will be that patient will be told to undergo, you will state it here. But if there wasn't any operation ordered for patient, you write not ordered. After that, date of discharge. Now your patient isn't yet discharged, so what you do is that you write not yet. After that, you come to patient problems, and have it in mind that all of these personal data that you've provided at the top there yields you 1 mark. All of these data yield you 1 mark. You get 1 mark for providing all of these data, so you need to be very fast with it since your time is not enough. Patient problems. At this point, what you're going to do is that you're going to list patient problems in accordance of priority. Okay, now you have the ABCs. Okay, you look at the patient symptoms or patient problems in the scenarios, and you get to realize, or you get to acknowledge the ones that are critical and can kill the patient anytime, or they can kill the patient quickly. I hope you understand. Good. With the patient problems too, we have objective symptoms or objective problems, and we have subjective problems. When we talk about objective problems, they are the ones that you, the nurse, you are going to use your equipment to check or to assess on the patient. For instance, temperature. So we have a way of you saying it or writing it on the care plan. You, because it is you, the nurse, that you assess the patient and realize that you say that patient has high body temperature or patient has low body temperature. But if it is a subjective one, subjective ones or subjective data are the ones that the patient will tell you, patient will verbalize. So the patient tells you that he has a history of vomiting. He has vomited 5 episodes. So that is subjective. Okay, so you say patient complains of vomiting. Patient complains of vomiting. Then you put the number of episodes in brackets. Is that okay? All right. So you arrange these patient problems or patient symptoms in order of priority. In order of priority, the one that if you don't attend to can kill patients anytime. After that, you move right to allergies. With the allergies, you look into the scenario according to the condition or diagnosis. If patient verbalized any of allergies, if it is, let's say, a condition like asthma, you know definitely the patient will have to be allergic to some dust, fur, or let's say hairspray. So the patient could tell you that I'm allergic, or he or she is allergic to hairspray or dust. You understand? And let's say a condition like stomach ulcer, the patient could say that he or she has allergy of um, food that contains too much pepper or spicy foods. Okay, right after you've written that, so you say, as for the allergies, you're going to say patient is allergic to, then you state a specific thing. If there are no allergies, you say no known allergies according to patient, or no known allergies according to medical records. After that, you come to patient strength. Patient strength. This is what either the patient or the nurse can do to help solve the problem or to help subside the patient's symptom. So the patient has high body temperature, and have it in mind that the patient problem at the top there have been arranged in order of priority. So you could number them 1, 2, 3, 4. 4 patient problems. And the strength you are going to write over here to must correspond to the patient problems at the top there. So if the first patient problem was high body temperature, the strength for the strength, what can the patient do, or what can you, the nurse, do to intervene, or what will be the intervention either from the patient or from you, the nurse, to help bring the problem down or to help solve the problem. Now, patient is going through pain, or patient is going through all of these discomfort, but patient is able to do something for that problem to be subsided or for that problem to be solved. That is the strength. The patient is able to do this though he or she is going through discomfort or pain. That is the patient's strength. So patient has high body temperature. The strength you are going to write there could be patient can cope with tepid sponging. Patient can cope with tepid sponging. You can also say patient can afford antipyretic medication. Patient can afford antipyretic medication. Is that okay? Now the next problem, let's say the problem that we wrote at the top there could be vomiting. So patient complains of vomiting. Now the strength will be patient can tolerate IV fluids or intravenous fluids. Patient can tolerate IV fluids or intravenous fluids. Patient can verbalize the episodes of vomiting. The episodes of vomiting. Even patient can also verbalize the onset of vomiting as well. So that is how you are going to state it. If patient can also afford antiemetic medication, that is a strength as well. Right after that, you go to routine care. If we talk about routine care, this is how often you are going to attend to your patient. Nursing care plan, have it in mind. Nursing care plan is patient-centered. So this is how often you want to attend to your patient. You want to attend to your patient, let's say every 30 minutes to check the vitals. You want to attend to your patient due to his or her condition. You want to attend to him or her every 10 minutes to check his or her BP. That is your patient. That is, you are doing it, you are doing it to better patient's condition, not to worsen it. So you do it according to how it's going to make patient feel better. So with the TPR, how often do you want to check your temperature, pulse, and respiration? So if it is every 30 minutes for 1 hour, then 4 hourly when stable. That is your decision. If you want to check patient TPR every 40 minutes, that is your decision. If you want to check patient TPR 1 hourly, 2 hourly when stable, That is your decision. Then you come to BP. BP too, the same thing. The same thing applies to BP. If let's say a patient has high blood pressure, then you have to monitor these patients closely. You can't say that because on the ward routinely vital signs are checked 4 hourly, so you are also going to check this patient's BP 4 hourly. No, it doesn't apply here. It is patient centered. So you are doing it to better the patient's condition, not to worsen it. So what you can also say is that monitor every 10 minutes or check and record every 10 minutes. So the TPR2 is the same thing. You can write check and record every 10 minutes, monitor and record every 10 minutes, or monitor and record 1 hourly. And then the BP2, you can say check and record 1 hourly. The diet. What kind of diet is prescribed or is recommended for patients according to his or her problem or his or her condition? Let's say a patient has ulcer. It's not every food that the patient will be advised to take. Okay, so the diet that is recommended for patient's condition, not to worsen patient's condition. If let's say patient is in good state, you can recommend normal diet. Let's say balanced diet for the patient. So you state it there, balanced diet. If patient is allergic, you check the allergies of the patient as well to order the food or to recommend the food as well. So if patient is allergic to spicy foods, you can say bland diet. And then the flus. If patient is on parenteral foods, no per os, you state it there. If patient is advised to take liberal or copious fluids, that one too you can state it there. Then intake and output. You monitor intake and output. That is the quantity of fluids patient take into the body and the quantity of fluids that patients eliminate out of the body or excrete. So that one too you write monitor and balance every 24 hours. Monitor and balance every 24 hours. Then we have oral hygiene. This is how you took care of patients' mouth, the mouth care of the patient. So you can also write twice daily with toothpaste and toothbrush. The bath too, you can write twice daily with water, soap, and towel. The urine testing. It can be serial urine collection. It could be anything. So you can write done on admission, or you can write not requested. So if patient's urine was taken for investigations, for lab investigations, if patient's urine was not taken, you can write not requested there. And then body weight, patient body weight, this will be stated in the scenario. So they could give you, let's say 70 kilogram, 60 kilogram, 40 or 58 kilogram. They will state it there and you write it. So with the BP, we have one at the top there already, so we just ignore this. And then the activity. So this is how patient walked to the facility. How did patient come to the facility? Did the patient walk by himself or herself? Was the patient in a wheelchair, or even patient at the ward? Is the patient able to do things on his own or her own? This is the activity. So if patient is ambulant means patient can walk, do life activities on his or her own. You get it? And then if we say bedridden, you can say bedridden. Bedridden too refers to somebody who cannot do anything, is confined to bed. You can also write confined to bed. Bedridden means patient is in bed, cannot do anything. You can say ambulation with assistance. It means patients can mobilize either by crutches or by assistance from a nurse. Okay, thank you very much. Don't forget to subscribe and watch out for the next episode, which will talk about the medications, other treatments, and investigations. Thank you very much. Bye bye. Hello viewers, this is the Master Medic, and today I bring to you the explicit explanation of the content of the nursing care plan sheet. Kindly like this video, subscribe, and share it to your friends to also benefit from this. What do we mean by nursing care plan? Nursing care plan section in your document is the heart of clinical reasoning and patient-centered care. Based on the surrounding of this page, it is structured as a formal assessment to use during practical evaluation. The purpose of nursing care plan. What is the purpose of nursing care plan? We do nursing care plan to demonstrate your ability to assess a patient holistically, translate clinical findings into actionable nursing diagnosis. Nursing care plan also plan, implement, and evaluate nursing